Another video. So I'm using like a recap the burr, the diamond burr. I'm using an Arkansas. Quite often I'm using Arkansas, and as a rubber optropole, disc, and a cotton. Okay, we have also pencil, and also we have articulated paper. Okay, this is our instrument for finishing. Of course, also the strips, the diamond strips, but to be very narrow, to go just under the contact point and not to destroy the contact point. So actually I create here a veneer. This is after the construction, and now I'm focused on the contour. So in the contour I go with the disc. I look here, this is a little bit wider than this one, but my question is why is wider? Because of the transition line, or because of the way I designed the incisor margin and the embrasures? But here it could be both. But first I want to be sure to not be confused by my eye, to be the embrasure to be symmetrically. So this is why I am focused on only just on incisor margin, not go on other thing. My focus is just there, because I know how important it's when I do this to have a shape of the frame of the picture that is our tooth properly with the other, and then inside to go with the texture with the other part. Good. So after I make with the disc, we go on the proximal. I open the embrasures because I found that this is a problem, and also I mark that points that I told you before with the contacts between the proximal and the incisal. So how I see here, this is wider than this one. The one is wider as a points here. So actually what I need is to change. These are quite symmetrically to the incisor margin, and for that I need to go with this approximately 1 millimeter more in the inside. So in this way I have a very good reference with the disc to go and to round this area on the distal, like here, to get the same result. But this is very structured in thinking, otherwise our eyes doesn't know always. Okay, if you are already with some experience, you will maybe find from your eye to check and to make it to be symmetrically. But if you are at the beginning, it's quite struggling, because you just take from all the parts of the tooth, and you have the perception, and you have the think that after I touch somewhere it will be the same in the end. This is like a guess, but it's not happening just sometimes. This is why this technique could help you to be more precise. So after you have this, you go with the transition lines. So you have the transition lines on the tooth that is as a reference, and now I go with my tooth. So you see it's the tip of the pencil is not touching the tooth, it's just the side of the pencil, and 45 degrees to the proximal, and I just move the pencil and you see the transition lines. Now the only thing that you have to take and consider is the distance between the transition lines. And this is also from dental technicians. We know the transition lines on the centrals, they converge somewhere a little bit higher, and the lateral, and they also have to be at the same level, and also the lateral more apically and canine more apically. Yes, here, as I told you, don't have these two lines to go and to connect together on the cervical. This area have to be flat. The line have to go under the gingiva. Okay. Now we compare the transition lines on the mesial and also to the distal. This is more easy, or we can measure the distance between the lines. We can see obviously that the 1-1 is more wide than the 2-1, It's not because it's too wide as a space, it's because the transition lines, they are too on the proximal, so we have to push them more closely, and also as they are more narrow on the cervical, and they are more wide here. You can now take another pencil with a different color and you can mark the line that you would like to have. So now I use the same pencil and I draw the line that I would like to have. So to remove that line, just take a diamond burr and you remove from the proximal. So in this way the line will be moved on the way you like. So if you want to move it more in the center, you go from the proximal to the center. If you want to move the line from the more on the proximal, you go from the center to the proximal. So now we see very nice the smear here that mark where will be finish of the line. So it's very close with the line that we draw as a line that we would like to be. But to be sure for that, we take another one more time the pencil and we mark again, but we mark with the side of the pencil and we know how the line is touching the white part of the where we touch the composite here again. So now it's closer. So it's a structured way of doing. I'll always ask when I saw these lines what these lines are for, and if you have this question, also now you know that these lines are for transition lines, that they are primary morphology, also the surface on the area of the proximal, these parts, and also the distance between the transition lines. Very important in the presentation with the proximal area, this area not to be flat, to be a little bit convex, so be careful to not flatten too much this proximal part. This is why we can use also a disc here to be more smooth and convex this area. So step by step we go and we finish the proximal till it's similar. We mark again with the pencil. It's the same procedure. We just mark, do again with the burr, mark, we do again with the burr. Okay, till our lines they are as close as possible. Using a napkin with alcohol, we can clean everything and we check again. So it's almost similar. When it's almost similar, then we check the second part, so the primary morphology. Okay. In this stage you can stay as much as you want. This why the finishing procedure sometimes can take longer than the construction. But in my opinion, after we understand this finishing procedure, I start to focus more on construction, to have from the first part of the composite reconstruction, in this case a veneer, to be more on construction. Be careful, because with construction is more easy because the material is flowable and you have a nice smooth rounded areas, and it's more close with the natural tooth, and the finishing procedure to be less and less and less. So I try to at the beginning to develop my finishing procedure, and after I mastering my finishing procedure, to go in the construction procedure and to reduce the finishing procedure as long as possible. The same. Good. Now we are the second morphology. So now we have the primary morphology done. Now the second morphology. The second morphology, we look just on the growth that we have and we follow that growth. With the burr, this burr I'm using a conic burr because with the wide part of the burr we can have the morphology more wide on the incisor part, and with the tip of the burr you can go more on details on the center. Yes. So now I'm using the more wide part of the burr, and now step by step I change the position of the burr and go with the tip of the burr more cervically, and I'm doing this second morphology. Anyway, with the burr I'm not getting too many nice details. For nice detail I will go with the rubber. Now I'm using a rubber. A tip rubber have to be as well conic, and a little bit to be hard rubber, not be too soft. If the rubber is too soft, you will not have nice smooth surface. So as you see here, the rubber is taking also a little bit from the composite. Mostly that you see in the picture is also the part of the rubber that it's destroying during the finishing procedure, but also it's active on the composite.